Hi, and welcome back to Mad-Endo. My name's Morgan, and today we are continuing our interview with Kristen Parise, founder of Blueberry Therapy and host of the Whole Shebang podcast. So, let's get to it.
My endometriosis clients are like warriors. They're in, and you're right. They're like you. They don't even realize how much pain that they're in. But it can be an incredible amount of pain that they are just managing every single month, and to get out of that is just so, it just allows you to live again, right? And yeah.
Yeah.
Our healthcare system does a bit of a disservice though too, because lots of time younger girls. Now, I will say I am seeing more younger girls identified with endometriosis, which I
Uh-huh.
because we know the average age to diagnosis or the average time is almost 10 years, right?
Yeah.
So
Mm-hmm.
those people are 10 years interacting with the healthcare system saying, I'm in pain with my period, or maybe they're not saying it because they just accept that it's normal. But 10 years of having a lot of pain. So the earlier we can get diagnosed and the earlier we can start some of these,
Yeah.
rapid treatments, the better people will do.
100%. Yeah, I can definitely say I wasn't diagnosed until they had to go in for, at this time, it's like 2007, I had a surgery, but they didn't even know I had endometriosis at the time. And everything I was going through, I thought, well, this is just how it is for me, right?
Yeah.
Having these crazy periods, and everyone's like, take a pill, take his birth control. And like, nobody knew at the time that if you're not reacting well to birth control, it's an indicator you have endometriosis. I had a wonderful gynecologist and a surgeon, and he did a surgery on me to remove this huge fibroid. And he was like, "You have severe endometriosis." And I was like, "What's that?" And he, you know what I mean? And he scraped and cauterized, as he said, everything in there. And I was like, "Well, okay, how do we get rid of it?" And he's like, "There's no cure, and it's probably going to come back." I was like, "Great." Okay. But I don't know where I was going with that. I think we were talking about early diagnosis. Yes. So I would agree it would be absolutely amazing if we could get early diagnosis. And I think it's awesome you're seeing a lot of young women, because then you can start building, like you're saying, these strategic plans to help them manage their symptoms around their period or any kind of just, yeah, so that they're on the track and they know, like knowing what's going on and having those symptoms and what's happening with you validated and understanding that is so huge. Because a lot of us, have gone through or we've been dismissed, or they think that you're making it up because this isn't working and that isn't working and I'm still in pain. And then sometimes it gets to the point where you're like, is it me? So getting that diagnosis early is so fantastic, because these women can understand and work towards building a strategy for themselves. So on that note, let's say a woman was going to see you and has endometriosis and still has having their periods. When's like the best time to get a pelvic floor therapy? Would it be like obviously I would imagine in between periods, but is it like 2 weeks before, or because I'm asking because I know with acupuncture it was suggested that I try come in 2 weeks before my period. So is it sort of similar with the pelvic floor, or does it matter?
It doesn't 100% matter, I would say. If somebody has really severe pain, sometimes we do want to see that. Like we want to see you at your worst so we can see if we can use some of the strategies to reduce the pain then. But
Right.
some people will say, like, I don't want to go anywhere when I'm in that much pain. I can't focus.
Yep.
So it's quite client dependent, I would say.
Mm,
If I just speak to, I mean, in terms of like wraparound services, I mean, back in 2019, I actually went to a conference that was all on pelvic pain.
okay.
Heard a really wonderful speaker talking all about endometriosis. And with endometriosis, some of the gold standards are seeing a pelvic floor physio as well as a psychotherapist too.
Mm,
Because we know, especially if it's been a long time to diagnosis, that you've been in pain, you know, you may have changed what you might have done in a relationship, let's say,
Yeah.
your ability to communicate, your ability to trust in your body. There's so many things that happen that having the two go together are super helpful. And then if I had to say what I think the third piece is that's like life changing too is naturopathic care, because a naturopath will spend more time and talk to you about what does your diet look like? What are you taking in? And if you can, most of my clients with endometriosis have some type of GI distress, whether it's
Mhm.
bloating or gas or constipation, all of those things. And so having the lens of a bunch of different professionals and having that care can help you with knowledge, can help you with strategy about where you're going to do specifically for you, and then help you think, maybe you are going in for a surgery, and what do you need to do mentally to prepare for that surgery? What do you need to do physically? Are there things that you can take from a supplement standpoint that might help you recover more quickly after the surgery?
Mhm.
So, um, I think that's important too. So you asked about when you should see a pelvic physio, and I'm just putting a shout out to my other colleagues that I think that there's some really good people in the space that are very, very helpful for the client with endometriosis.
I agree with you as well. I think the psychotherapy part is huge. I never felt when I had endometriosis that was ever anything I needed to go see a therapist about. I was very just like, oh well. Um, but it wasn't until I saw my surgeon, Dr. O'Leary, who is amazing,
Mhm,
and she really clarified and gave me a lot of education about the disease, that I started to realize that I really should see somebody because it's affected me so much and it's affected my relationship. Eventually, because I got so bad, it affected every aspect. Like it affected me to the point of disability. And I was like, okay, I really need to go see somebody now. But like almost even the language I would use is allowing myself to say yes, like endometriosis is something you should maybe see somebody about because this is a disease that there is no cure for and it lasts forever. And sometimes even just accepting that can be a challenge. When you're first diagnosed, you may not want to hear that there's no cure, that this lasts forever. But I always try and speak to a lot of positivity with that as well. Like, yes, this is something that is with us for the rest of our lives, but there's still a lot of life to be lived. And part of that is getting that diagnosis and finding these supportive methods that can help you, as well as taking care of your spirituality and your mentality, which is the psychotherapy. And I think for a long time, I didn't even consider that because I think a lot of the time I was just really focused on getting through it
mhm,
and not like saying, I didn't want to get emotional about it. But when you finally allow yourself, at least for me, I finally allowed myself to feel emotional about it. And like I think it really came through Dr. O'Leary actually validating it for me. That I
mhm,
was like, okay, so yeah, like I'm allowed to feel about this. This is real. This is horrible, right? Okay, I'm gonna feel it. And yeah, so I completely agree. And that with the natural path, I do know that some women have really found that very helpful with supplements and with diet really helping with their symptoms as well. I know that for me, one of the symptoms that really was so challenging was fatigue because I had dealt with this at a severe level for so many years. All my body was getting so drained because there was no reprieve or no rest or recovery. And after the surgery, I went to see Dr. Amin, and she was very, very helpful in informing me about how long it can take to recover your energy levels. And she was very helpful with some tinctures and we did some meditations. And she was really lovely in helping me understand and work towards that. Because sometimes it can be like, okay, I want to get better right now. I've had my surgery, and it's like, well, no, you've been in chronic pain for many years. It's going to maybe take a few years. And I found out a little bit later through, talk or watching somebody else or little podcast about endometriosis and her saying as well, it takes about 3 years after hysterectomy to really feel 100% again. But it's so important to stay with these alternative and supportive methods. Like just because you have a hysterectomy or you have an excision surgery doesn't mean it's over. We still need to support ourselves and like almost adjust to life as well. So yeah. Yeah. Um, can we talk a little about the neurobiology of pain? What about, would you say anything more to the question of how does pelvic physiotherapy help retain the nervous system to reduce pain?
Yeah, I can speak to that for sure. I mean, one of the things that we do typically in an initial assessment is do some sensation testing, right? So
Oh, okay.
as I'm doing, let's say that vaginal assessment, I'll be pressing over towards the client's right, and I'll say, what direction is that? I'll press towards the left. I'll press up
Oh,
and down,
interesting.
and people who have been in pain often get that like very wrong. Like they'll get 3 out of 4 of those wrong.
Oh, wow.
And I think it's like a protective mechanism. So when they've been in pain for so long, it's almost like the nerves are sending an error signal to the brain. And so what we're trying to do with pelvic physio is really get a muscle that's functional, that relaxes well, that contracts well, that you feel exactly what's happening.
Hmm.
The sensations are not either incorrect or elevated, that kind of thing. And so as we're working along and people are getting out of pain, I see that the muscle's moving better. And I go back and do that sensation testing, and they'll be 100%.
Oh,
So
neat.
it's a bit of a rewiring of the nervous system, which we know. I mean, the brain is so plastic. It can change so quickly. The nervous system, we can make sure that it is changing at the same time. And I think in doing a lot of the exercises that we're doing and or some of the meditation, anything that stimulates our parasympathetic nervous system, that's that rest and digest system,
Hmm.
can help to change that chemistry in the brain that has been changed by all that pain back and reset the brain.
Okay.
Mhm.
That is so neat. I never thought about that. So that's really cool, that aspect of things. That's so cool. Um, just to ask a couple more questions on endometriosis. What are some of the biggest misconceptions about pelvic health and endometriosis that you encounter?
Um, I think a lot of people with endometriosis think same as with pregnancy, actually, that they will come see a pelvic physio when they've had their excision surgery or something like that, right? Like,
Mm,
so I've got this condition, then I am going to have this surgery and I'm going to go there to help with recovery. And we really want to see people before because that's going to help with pelvic floor lengthening, pain management, maybe even some digestive things in advance of that surgical procedure, so that on the other side of the surgery, which we know surgeries can create some pain, we've reduced the pain going into surgery such that you're not really escalating it as much. So that's one of the things I would say. And then I think people recognize now that there are pelvic physios that deal with peeing and stuff like that, but sometimes people are really hesitant to say that they're having any kind of pain with intercourse. And and
yes. Yeah.
and so while people will come in with endometriosis and say that they have a pain in the pelvis, they have pain in their low back, they're leaking a little bit of pee, they have a bit of constipation or bloating, they will stop there. They will not say anything about intercourse. And then we, as the pelvic physio who does the internal assessment, they're in pain like crazy with the internal. I often sit them back down and I'll say, I did note that there was a bit of pain there. Are you having intercourse? How does that feel? And then they'll open up.
Mm.
So I think scope of what we do is one of the things that people are not necessarily aware of. And then I think the other thing is what I mentioned before is that we are somebody that you see after a surgical procedure, but we really want to see you before.
Yeah, definitely. Dr. O'Leary pretty much said you got to have pelvic floor therapy, because she said she found a lot of women have experienced less pain post-surgery if they see a pelvic floor therapist before. So, and yeah, I can say I think it was quite helpful.
Yeah, and it isn't just the things that we do from a hands-on perspective or get you to do, but it's a lot of the education because you said it a few times in this podcast. When you understand what's happening more with your body, it's easier. It's easier to
Hmm.
understand. It's easier to recognize that the pain is because of something like it. Otherwise, you're operating in a vacuum. You don't know what's going on, and that's scary sometimes.
Yes, absolutely, absolutely. Yeah, the knowing what's going on is huge because then, yeah. How do hormones in the menstrual cycle influence pelvic pain and muscle tension?
Yeah, so we see that when people are cycling, so they're having their menstruation, that there is a change in the way the pelvic floor works, especially as our estrogen goes down. And we're not 100% sure why we don't think it's a direct result of estrogen goes down, muscle function changes. But when estrogen goes down, we have changes in blood flow to the muscle. The muscle tends to not hold tension quite as well. So
Mhm.
lots of people between their ovulation and the beginning of their period, and sometimes right at the start of their period, if they're going to have feelings of heaviness or pressure that or some incontinence, that's when they're going to have it. We also see that people through perimenopause and menopause, when estrogen changes, that their pelvic floor function changes. And then we might see more pelvic organ prolapse or that dropping down of pelvic organs, more incontinence. So we see the impact of hormones for sure.
Mhm.
And people with endometriosis for sure, we see not just changes in how the pelvic floor function with hormone changes, but pain associated as well. And so that cyclic pain is one of the things when we're talking to people who don't have a diagnosis,
Yeah.
we're kind of querying, is this happened all your life? Are they really heavy and painful periods? Do you
Mm.
have a sister or a mom or an aunt or a grandma? Because there tends to be some genetic component too, right? So we're asking all those questions when there's cyclic pain and cyclic changes in the way the pelvic floor functions.
So do you think that the like through what you do that if someone came into your office that wasn't diagnosed with endometriosis, do you think that you might think have you ever been suspicious like, oh, maybe this person has endometriosis, but they haven't been come in with a diagnosis? Oh, you
A
have.
lot of times.
Oh, wow.
Lots of times. And it might even be that I've seen somebody after they've had a baby or something and they start talking. And I assess, and there's tons of pelvic floor tension. They say, even from the time that they started menstruating, it was painful to use a tampon. Sex has always been
Hmm.
painful. And then I start digging a little more, and they have, an aunt and a mom who had the same thing, and their grandma had an early hysterectomy. You start to see the patterns for sure. And by no means can we diagnose something like that, but we can say to people, this is a pattern that I see sometimes when people have a condition called endometriosis. It impacts 1 in 10 women. And even Dr. O'Leary will say that's probably a little low.
Yeah.
It might be something that you want to chat with your doctor about. And you might want to pursue it if it's causing you issues. Maybe there's somebody who is struggling for fertility reasons too, right? And
Right.
I think we are getting better at about identifying, as I said before, I am seeing younger girls diagnosed with endometriosis, but sometimes we just need to have people say the right words to potentially their healthcare provider, give just a little bit of a push because um, we're teaching how to advocate sometimes, I think.
Yes. Yeah. Yeah. I do think at times we do have to be our own advocate when it comes to these kinds of things for sure.
Yeah.
Sorry, you touched on perimenopausal. is there like if so I have endometriosis and I'm kind of in this perimenopausal stage as well. Like
Mhm.
how do you treat someone with these two things? Because my hormones, like you know what I mean? Like how is there a different way in which you would treat me or what do you like, hang on, what happened? I don't know
I
what the
mean,
question is, but you know what I think you know what I'm trying to say. So
no, I think I know you. We definitely see people who have endometriosis and are going through perimenopause. And I think having a really good doc on your side, like Dr. O'Leary, is
Mhm.
super because she's going to make sure that you are following whichever treatment makes the most sense. Maybe it is surgery, maybe it is a certain type of medication that's really addressing your symptoms. At the same time, from a perimenopausal standpoint, we're going to be monitoring to see are there changes in urinary incontinence, urinary function, urinary urgency? Are there things happening where you're feeling more heaviness, pressure? Can we recommend additional pelvic floor supports? And, I do see a lot of people actually for vaginal pessaries.
What's
So that,
that?
yeah, it's like a vaginal brace. So
Oh.
people that have, let's say, anterior wall prolapse. So that's where the bladder is pushing into the front wall of the vagina, and there's heaviness, pressure. Sometimes people feel like things are falling out. So,
Mhm.
so even though, you may have had a very tense pelvic floor most of your life, that certainly people with endometriosis can have pelvic organ prolapse too. So I mean, we're doing the things we would do anyway in this time period, but we want to make sure that the endometriosis symptoms are being well treated, likely with your medical provider, also doing pelvic floor lengthening, um, talking about how you have sex without discomfort, because you might that might be compounded, right? If you've already
Mhm.
felt this tension and pain in the past, and now as your hormones are changing, as you move towards menopause, you're having a little more vaginal dryness, discomfort with intercourse, all of those kind of things that
Mhm.
so we might be extra vigilant on those things to implement some strategies early because you've had pain in the past too.
Right.
Because pain kind of begets pain, especially when it's pelvic
Okay.
stuff. So if you've
Okay.
had some pelvic pain, that's what the research shows is that later in life or at another time, if something happens, your body kickstarts and jumps into that pain a little quicker than maybe somebody who had never had it before.
Right. Like a muscle memory almost.
Yeah, kind of. That's one
Mm.
way to describe it.
What changes would you like to see in the healthcare system regarding women's health and chronic pain management? I know it's maybe two things.
That's a big one. But if I start with women's health, I think I think sexual health in general, if I just say that, whether you are man, woman, or any gender, needs to be addressed at a younger level. So I
Mhm.
think I've been kind of on the bandwagon for a number of years of, we pull girls aside and we talk about menstruation, but we never talk about like if you have a pain with tampons, if you have pain with intercourse, we don't do a very good job about talking about all of those things. And the fact that pleasure is something that we want to strive for. Like it really is. I spoke with Dr. Nan Wise. She's a wonderful neuroscientist, and she wrote a book, Why Good Sex Matters. And she says pleasure is a human necessity, not a luxury. And I like that. And I
Yeah, I
think
like that too.
yeah. So I think we need to do better education from a very young age.
Hmm.
And then as people move along the continuum, there could be education at different points. And maybe it is that well person checkup with a physiotherapist or someone else
Hmm.
so that we can get really good valid information at that point. And then I think as we age, then when we get to perimenopause and menopause, I mean, it's kind of having a day right now, which is fantastic
Yeah.
because the information just hasn't been there, right?
Yeah.
And so, what other than people? searching for information when you're in your, late 30s, early 40s, late 40s, you just don't get that. So I think across the board, women's health has a really long way to go to systematically educate people as in the stages that they're going through, because that has so much power. I remember reading a paper a long time ago that said there were all these women that were having sexual pain.
Hmm.
Sat them down for a 3 hour information session where they were talking about, and they were all in the menopausal or perimenopausal period, and sat them down and talked about what's happening with your body, why it's happening, what are some things you can do to prevent it. And then they talked about doing pelvic floor contraction and pelvic floor release exercises, which, I previously have said isn't that crazy impactful, but that combination of education for these women resulted in increased sexual satisfaction, increased ability to orgasm, and a bunch of other things. So that just good information is really powerful, and it would be really good if we're getting the information before we're jumping into a stage. And so that's one of the things I think about what could happen with women's health.
I really love that. Sorry, I'm just going to pause because I just love how you put that together. I really love I totally agree. Like, accurate information is so powerful. It's so liberating, and it's so important. And having it at the stages, I was like, I love how you've put that out there. I love how you've thought about that, and I totally agree. And I can say, like, it was one of the. It's so frustrating sometimes when you're trying to find accurate information. The resources. Well, what resource can I trust when I'm not really sure? And you're trying and you're searching and searching. So being able to find a resource that you know is going to give you accurate information and getting that information to you at a particular stage or before that stage is, I love that. I think that's wonderful. Yes, I'm 100% agree. Yeah.
We'll have to do it, you and I, Morgan.
Yeah.
I like
I
it
like
too
that.
because you know what? At one point, I thought, we just need to give younger people more information about the whole thing.
Yes.
But when you're 13, you're not thinking about what happens at 45 and 50. Like you might give a little information, but then maybe when you're in your early 20s, you're giving more information about, if you think you might have children, here are some of the things.
Mhm.
If you don't, that's absolutely fine, but here's some other things. And then when you're in your, late 30s, here's what's happening as your body's changing after you've had children or not, or and then again maybe in your early to late 40s, here's what's coming up, and we could do it again too, and it's important too for emphasizing that women need to be moving, that need to be
Mhm.
lifting weight, we need to be socializing for bone mass, brain health, lifespan. Like, I mean,
Yes.
there's really good data associated with people that have a really good social network and relationships actually live longer. So, I mean,
Mhm.
we know all these things, so we just need to spend a bit more time figuring out a system that gets that good information to people when they need it.
I love that. I absolutely love that. It kind of made me think about something, which is kind of a little bit off topic, but we're talking about, kids and 30s and stuff. And then is obstetrics, is that right? Is obstetrics? I've noticed a trend over the years of women having babies later in life and later in life, and now even in their 40s. From what has your experience been with that? I don't really know what the question would be, but I guess, like, I imagine you've noticed that as well. And how would you support a woman that's like, oh, I'm 42 or whichever, and I want to be pregnant? Like, how would you support that?
Yeah, and we see that through the office too. And a few years ago, I had a really lovely woman have a baby at 48. First baby.
Wow,
Yeah. So
that's amazing.
they, there's a few things there. We know that there are changes in muscle function past, like as we hit 35, things kind of peak and then in lots of ways, things change, right? And so we lose a bit of muscle mass. We the way that our muscles contract and everything isn't quite as good. And so that's not to say we can't fight against that, but we know that people that are going through pregnancy a little bit later might have a little more muscle dysfunction. So we might be a bit more active in what's happening during their pregnancy to prevent things later on. Um, and then I would say that um, there are things that we're going to want to do to help them with delivery, with positions for birth, all of those kind of things. Not that we wouldn't do that in any client, but we might just be a little bit more hands-on because we know the body's changing a lot during that time period. And then I would say then the last thing is lots of my women in that time period are conceiving with the help of some type of fertility. And I mean, that's amazing. And I'm so
Hmm.
happy for them. At the same time, the going undergoing those fertility treatments sometimes can be painful. Sometimes
Hmm.
that can elicit some different responses. And so we're having those kind of conversations too.
Hmm.
I think those are the things that I think about with somebody who's having babies a wee bit later on.
Okay, great. Thank you.
You're welcome.
Was there to go back to the original questions that one just kind of spawned in my mind, but yeah, was there anything else in regards to like women's health you want to see change in the healthcare system or chronic pain management?
Yes, chronic pain management. I didn't even mention it all. So get into the women's. So I think chronic pain management, um, there's lots of change that could be done there as well. And
Really
I think early identification. So if again, if somebody's had pain longer than 12 weeks, we would call that chronic or persistent pain. And at that point is when we want to flip into the strategies where we're really addressing the brain. And
interesting.
so, 12 weeks is not a long time. You have lots of people who have a hamstring injury for 4 months, right?
Yeah.
Um, so that comes down to some of our healthcare providers having that knowledge. It comes down to the public understanding that if I've been in pain for longer than that 12 weeks, then I'm not just gonna be uh, looking for what's happening with my muscle, my tendon, my bone. And people are often seeking, like, what is the problem? Why is it there? I'm going for an MRI. Now I'm going for CAT scan. Now I need an X, they're like seeking the medical system when what we actually need to be doing is doing some down training of the nervous system to help support them. And, please hear me, those people are in pain. Like
Yeah.
I'm not, and by no means saying that they're not actually feeling the pain. I'm just saying the approach that we're going to take is
Hmm.
going to address the pain in a different way. And that different way is to use some really good strategies to address the neurochemical changes in the brain. And so, we've talked about a few only, but
Hmm.
positive movement can be one. Again, finding joy in different things. Um, Spending time with other people, being creative. So accessing other pieces of the brain can actually help downregulate the system in the brain that is really focused on the pain. So we have clients that are, that are sewing or doing art or, right into photography. So creativity can be helpful. And there are people that do this a lot better and a lot more than me. But so for the chronic pain across the system, people need to understand what it is and why it's there. And then any provider that they bump up against needs to recognize it and make sure that they're not just like treating the spot, treating the spot, treating the spot, right? And
Hmm.
we do, even I do that myself sometimes, right? Like you get really focused on what you're treating, and then you have to kind of like scale back a little bit and realize, ooh, the brain has been changed here. I need to include that in a piece of my treatment.
That's so fascinating. I really love that. I haven't actually heard somebody talk about the neurobiology and the brain reaction to chronic pain before, and then just thinking of that, obviously from the endometriosis perspective, that's amazing. I really find that quite cool. I'm going to dive into that, I think, a little bit when we get off.
We talk about the biopsychosocial approach or central sensitization. So there's a bunch of different like lingo that we use in this area. And again, I am by no means the expert.
Mhm.
Um, but if we can leverage some of those additional treatments that aren't solely focused on the muscle, the nerve, the acute location, then we can do a really good job to address the pain more globally.
I love that. Thank you.
Welcome.
So, on that note, do you have any resources or books or podcasts or anything like that that you would want to recommend to anybody to learn more about a chronic pain or pelvic floor therapy or anything that you feel that would be useful?
Yeah, there's a great book called A Headache in the Pelvis. That's a really good
Oh,
one.
wow. Okay.
Yeah, that's a great one. And for healthcare providers, there's all kinds of training you can do about the biopsychosocial approach. We actually can use different questionnaires as people come in, and it really helps us to know how much of what they are experiencing is due to this brain change. And for people, there's a really very quick and easy YouTube short that's called Pain Explained in 5 Minutes, I think is what it's called. It's a YouTube short, and
Mm.
it just explains how if you have ever been in pain longer than 12 weeks, what is happening, what's happening to the nervous system, um, and it also talks about different types of approaches to manage it. So that YouTube video is a really, really quick and easy one. I often show my clients. We watch it together and then we have a conversation. And it resonates with some people and not others. And then there is a really good resource. It's a Neil Pearson resource, and it is a really good one. It's a bit of a workbook for pain.
Oh,
Uh,
neat.
and so one of the things that we do with people in explaining the pain mechanism and neurochemistry, that actually helps people's pain come down because they recognize what's actually happening in their body.
Mm.
So I often give them this workbook to kind of work through. So it explains what's happening, what are the emotional threats, psychological threats that might be causing this pain. And I often give this example to my clients, and that is, you know, if I'm having the worst day of my life, right? I've had a fight with my son and I'm late for work and I forgot my lunch and I stub my toe. Then that stub of my toe is like incredibly painful. Like I feel it, it's burning, it's driving me crazy, it makes me mad because I've already had a bad day.
Yes.
On the flip side, if it's my birthday and I'm having a party and all the people I love are in my house and I've just been given this lovely gift and everything and I stub my toe, I stub it, I recognize it, I keep on moving,
Mm.
right? It's the same input, the stub toe, but when you layer in all those emotional and psychological things, pain is expressed in lots of different ways, right? And
Hmm.
so in this case, when I'm not having a great day, that pain becomes so heightened. And then
Yeah.
when everything is going well, that same input means I don't feel any pain at all. So pain is not an objective thing. There's a subjectivity to pain. And so that's the other thing that we often talk to clients about.
Okay. Thank you for that.
You're welcome.
If you could give one piece of advice to someone struggling with endometriosis related pain, what would it be?
Recognize that you are not alone, that it is something that people feel, that it is real, that it isn't that you are just have a low pain threshold, that you are in serious pain.
Yeah.
And then, right. Get some help. Get some help with like there are some good resources that you can read. You can reach out to a pelvic physio. You can talk to a psychotherapist about strategies to manage pain and emotions, to manage sleep. Lots of times when sleep is disturbed, then that pain gets even worse. So
Mm.
those are like basic things, but I want people to know they're not alone. The pain is real, and that there are resources out there that can help them.
It's funny that you say you're not alone because I always end my podcast in saying, remember, you're not alone because it's so true. So it's awesome that you said that. I'm like, yes, I know. That's great. What is one small change a person can make today to start improving their pelvic health?
If we're thinking about that person with endometriosis, it is doing some deep belly breathing. Nice and simple, but when we get into a stress response, we really do these really upper chest, little tiny bird breaths.
Mm.
And that means that the diaphragm, that big breathing muscle, doesn't move very much. Then the pelvic floor doesn't move very much. As soon as we do a belly breath where the belly rises, the rib cage expands, the diaphragm lengthens or goes down, it puts a little pressure on the pelvic floor lengthens, and that in itself can make a really big difference. Pelvic floor lengthening helps with reducing pain, having better bowel movements, not feeling urinary urgency. So it sounds basic, but deep breathing and even doing it for, let's say, 2 minutes a day can make a big difference.
Awesome. Thank you. And my last question for you. How can people support your business and spread awareness about the importance of pelvic health?
That's a
I
good
would I would say first they should listen to your podcast, the whole shebang. But
You can listen, yeah, the whole shebang, the whole like HOLE. I always tell Morgan that as a professional
yeah.
physiotherapist that does pelvic floor, that I'm just a hired finger.
I love the name. It is hilarious. The
Yeah.
whole
So you
shebang. I
so
like
certainly listening to the whole shebang. You can follow us at Blueberry Therapy Pelvic Health on Instagram. And that Instagram, Facebook, different, social media definitely gets a bad rap about certain things, but we put out lots of really good information. There's some really good free resources. Um, and we're always telling people about what's coming up next in terms of group programs or new staff coming on board. So that would be great. And they can come into the business, they can refer a friend to the business. And then we also have that online store too. So for
Mm.
all different things like um, lubricants and pelvic floor trainers and shorts that you can wear if you have any type of pelvic burn prolapse. There's lots of different ways that they could support. But I think in general, whether you're in the Dundas Hamilton area and coming to Blueberry Therapy or not, I think there are a lot of really fantastic pelvic health physios in Ontario, and going to see one to help yourself is like one of the best things you can do.
Thank you very much for your time today, Kristen. That was really informative and very amazing. I think there was some things I learned there, and I think my viewers will really get a lot out of that. It's very helpful, and I really appreciate it. Is there anything else before we end that you'd like to say at all?
I just want to say thank you. I love the opportunity to talk about this stuff, and it's been a really fun conversation, Morgan. So I appreciate you asking me. Thank you.
Thank you. Thank you for joining me today. I hope you enjoyed the interview with Kristen Parise and found the information useful. If you haven't listened to part one of the interview just yet, then I encourage you to find a bit of time and take a listen. Endometriosis can feel like a lonely disease sometimes, but remember you are not alone. Stay strong, and I will see you next time.